Trauma is stored in the body and can come out as chronic pain and symptoms. One of my main goals as a therapist, working with clients with chronic pain and symptoms, and also providing content on this YouTube channel, is for us to understand, for the whole world to start to understand that chronic pain, chronic fatigue, chronic dizziness, other chronic illnesses are often a symptom of trauma. And so I want to discuss this linkage, but first we have to discuss what trauma actually is. You know, in pop culture, they often talk about a traumatic event. Something traumatic took place. But trauma is not the event that's happened to you. You know, one event, one overwhelming event, could leave someone with a trauma response and someone else completely fine. So the trauma is not the event in and of itself, it's actually the response in the nervous system. And this definition comes from Peter Levine, who is the creator of Somatic Experiencing. And I think it's really useful for us to understand. Now, we're not to blame. We're not to blame to have a trauma response. I want to be clear about that. We don't control how our nervous system responds to something. We don't control how our nervous system responds to overwhelming events. You know, this is based off your biology, based off every event and moment that's ever happened in your life. That's what's helped your nervous system develop a certain way. And this is not a cognitive issue. We can't control it. But a trauma response in the nervous system, you know, when we talk about Polyvagal Theory, can look like two different things. Either this could be a high sympathetic response. So this is when your nervous system becomes mobilized. We can become nervous, anxious, panicked, hypervigilant, sweaty, heart rate racing. It could also be things like agitation, frustration, anger, rage. But this high sympathetic response can often occur after overwhelming events. And this is a type of trauma response that can happen. For myself, this is kind of my home base, or was in the past, that I kind of snap into really easily. And this occurred for me based off adversity I faced earlier in life with bullying and other overwhelming events, even chronic pain and symptoms that left me with kind of a trauma response as well. Now, the other type of trauma response that can happen is this low dorsal vagal response. So this is where we shut down, we become immobilized with fear, we go numb, we dissociate, we become in a state of despair, hopeless, helpless. And so for a lot of people, this is the most common occurrence that happens with trauma, is this low dorsal vagal response. Now, it's not necessarily one or the other, like sympathetic or dorsal, like some people oscillate back and forth. But this is what trauma actually is. It's this trauma response in the nervous system. Now, when we talk about chronic pain, chronic fatigue, other chronic illnesses, they are a symptom of trauma. They are a symptom of this prolonged state of high sympathetic or low dorsal vagal. So when we talk about a trauma response being sympathetic or dorsal, it's prolonged. So after an overwhelming event, people don't have the ability to shift out. They're spending excessive amounts of time in these survival states. And when you're there long enough, chronic pain and illness is a natural symptom that your nervous system starts to produce. It's trying to warn us, it's trying to protect us that it's feeling overwhelmed, that it's feeling in this state of high survival, and it's struggling and feeling in danger. It's letting us know through these physical symptoms. And so our medical system has medicalized the heck out of chronic pain and illness. Drives me nuts. And, you know, at the end of the day, the medical system has lots of benefit, especially with acute pain, symptoms, injury. It works really well. But the results for treating chronic pain and illness through the medical model is actually quite poor if you look at the outcomes and research, depending on the condition, but for the vast majority, it's quite poor. And that's because for most people, What's happened is there is this trauma that's taking place. Now, you might be watching this video and be like, I don't have trauma. Trauma is a part of life. It's a part of life that we're all going to experience overwhelming events. And it's a spectrum. It could be, more intense or less intense, our response. But don't go based off the event. Because I've seen, objectively from the outside, someone would say, hey, that was a small event. But someone had a really dysregulated trauma response to that event. So don't go based off of how big or small the event was, because that's not a good measure of how much trauma is occurring in your system. And so when we talk about trauma in this way, it's really important to understand that part of healing neuroplastic pain and symptoms, which is what we're talking about, is actually treating the trauma. Now, if you're watching my videos, you've probably watched other channels out there. And there's lots of great other mind-body channels. One thing that bugs me in this mind-body world, and I don't think people do it intentionally, but they simplify it. They simplify the mind-body healing. And that works really well for some people. It does. It works really, really well. You do changing your thoughts and beliefs about your pain or symptoms or your body. You start to do somatic tracking, which I love somatic tracking. It's on this channel. You start to do some behavioral changes. You live life differently. A lot of these techniques, they work really great if people haven't experienced trauma. But if someone's experiencing a trauma response, those basic techniques are often not enough. And the reason it bothers me is because people start to feel hopeless about this approach and that it's not going to help them. Because they try some of the basic techniques like changing their thoughts and beliefs about their symptoms, doing somatic tracking, brain retraining, and they don't see a good effect, so they just kind of give up. But the reality is sometimes this deeper emotional, this deeper trauma work needs to be done. Now, how do you deal with trauma? There's a lot of trauma models out there, and I want people to really explore that. Find a therapist that you relate to, that you connect with. Their approach matches what you're looking for. At my clinic, every therapist, we all use some different approaches for dealing with trauma. There's a therapist trained in EMDR. I'm trained in ART. I'm also trained in getting trained in somatic experiencing and have a polyvagal lens. Radical exposure tapping, one of the therapists used that, and prolonged exposure. So there's a lot of different trauma models out there. And there's no right or wrong here. I think some people get really caught on, I need to find the right trauma model. But you need to find the right trauma model for you, is really what it comes down to. So if you've tried some of these basic techniques and you're not seeing progress, it may be time to actually start treating this trauma response, because this is going to perpetuate things forward. And when we talk about a trauma response in the nervous system, this also happens with chronic pain and symptoms. Something I really focus on with people is what I call sensitization trauma. This is when the onset or progression of your chronic pain or illness causes this trauma response, which is quite normal as a human being. If you're confused about why your body's having these symptoms, the medical system isn't helping you. You've had scary treatments. You feel hopeless or helpless, shut down. We start to have this trauma response to the onset of progression of our symptoms. And so your chronic pain or symptoms can cause trauma. And sometimes this sensitization trauma needs to be processed. So I hope this video helps to clarify how trauma and chronic pain are linked. Please put your questions or comments down below. Hit the like button, subscribe to my channel, and I will talk to you all next week. Take care.